done seen on the news how many people done passed away from it, and I said somebody was going to bring it here, and they did.
I believe it's going to spread.
Don't panic. That's the message from health officials from coast to coast as more details emerge about the first patient to be diagnosed with Ebola here in the U.S. Doctors say it's important to keep things in perspective. Ebola is still rare and relatively difficult to transmit. It can't be spread through the air like the flu or other diseases.
It is not spread by touching people. It's spread by bodily fluids. I think people have a lot of anxiety because obviously the mortality of this is greater than 60% or 70%.
The Ebola outbreak in West Africa has spread rapidly, killing more than 3,000 people. But here in the U.S., the CDC says it's unlikely to spread because of our advanced public health system. Every hospital in America has plans in place to stop Ebola in its tracks.
We have isolation beds available, both in the ER and in our inpatient side.
We have educated our staff. We have actually prepared Go kits that has all the necessary personal protective equipment in it for our healthcare workers.
And if that comes up or the patient says, yes, I've been to West Africa, then a whole different slew of protocols comes in place. Right. They have specific isolation masks, their body fluids are handled in a different way, and they have separate areas.
In the confirmed case of Ebola in Dallas, the patient did tell a nurse he'd recently been to West Africa, but was initially sent home. Hospital officials now say that was a mistake, calling it a breakdown in communication. So as health officials work to calm the public's fears, the old adage becomes a mantra: expect the best, but prepare for the worst.
You need to be aware of what's going on, but you do not need to be concerned because the risk to the general public is infinitesimal.